Hi and welcome. My name is Vanessa Desir. I am the director at Attento Counseling Marietta, as well as a certified Ketamine Assisted Psychotherapist.
And I'm Dr. Les Cole, colleague of Vanessa. So glad you're here. Appreciate you taking the time to listen to our program and understand it a little bit deeper. I too am a Ketamine Assisted Certified Clinician as well as a licensed professional counselor. And as I said, it's great having you here today. We're located in Marietta off of Terrell Mill and Powers Ferry Road. That's our main office, and you'll be seeing a little bit about the office as you get a visual tour of sorts. It's a very warm and comforting place, and we're looking forward not only to talking to you today, but to being able to host you here. I'll tell you a little bit about our team that we've put together, about which I'm really thrilled. Of course, Vanessa is a colleague of mine. Our team is comprised of licensed clinical people, physicians, and also we have two wonderfully equipped certified CAP specialists. That team works together literally as a team. While you'll be interfacing with one therapist throughout your trip here, you will also be supported by the physicians and the team as a whole to make sure that we're wrapping around you the support you require in order to be successful in your pilgrimage. Our program is a little bit unique with our medical part. We're able to provide the best dosage medium based on the physician's recommendation. We have IV, we have IM, and we also do tabs. So when your referral comes to our physicians, in the medical part of it, it will be determined what the best medium is and also what the dosage is. We will then turn every session, regardless of how it's administered, every session is bookended with CAP support. And this is what separates us. It's the individual attention and support that bookends the experience, not only the day of the experience, but throughout the entire journey. We will be there to help them take maximum advantage. One of the beautiful things about ketamine that really differentiates it from the other psychedelics is we know it has, for example, an immediate antidepressant impact. What that results from is the work of the molecule. And the molecule creates somewhere between a 48-hour and a 2-week window where the new dendrites and neuroplasticity is available to create new neural pathways for the new experience, for that place in life where I'm not driven and controlled by the habitual pattern of the depression. And we work with them to integrate that in a lifelong process. The ketamine does the work of creating potential. The CAP part does the work of moving potentiality into reality. And we will be there with your folks every step of the way, returning them to you in a much greater place to be able to utilize your skills and insights. So we really appreciate you being here and thinking about how we can be a team and support you and your patients. Vanessa, you want to say a little bit about the process?
Well, the purpose of this video is to inform therapists, psychiatrists, and medical professionals of the intake process. As we know, that could be the hardest part of the entire process, and we want to make your clients feel the most comfortable. We want to make you feel the most comfortable. And the way we do that is that we share as much information as we can to the clients and to you, so you know that your clients are being taken care of from the very first call. It's important to us that they feel supported during a very nerve-wracking time. Our goal is to make it a quick process, a comfortable process, and to make sure that they leave informed every step of the way. So we want to just thank you for referring your clients over to us, and we want to assure you that we're going to take special care of them and keep you informed the whole way through. Les?
Absolutely. If you take nothing else from this short video, I would want you to take away the fact that for us at North Atlanta Attento Ketamine Clinic, it's personal. We've worked really hard, not only in the set and setting of the session, we've worked really hard in how we've developed this program. It's personal. And we recognize, because we're all clinicians too, that your referral is a huge investment of trust in us. And we will continue to do everything on our power to justify that decision on your part. If you ever need anything, you have any questions, you see something we could do better, you'll have my phone number as the director of the program. Never wait or let something drop. Let me know, and we will make sure that we fill any gaps that might emerge. Our goal is not to have gaps, but if we do, we'll be there to serve you as well as your patient. Thank you so much for the trust that you place in us in the referral. I'm really excited about this next phase. We have an opportunity to meet our medical team, Dr. Thomas and Dr. Todd.
Hello, my name is Dr. Naveen Thomas, and this is my colleague.
Hi, my name is Dr. T. Todd.
And we are honored to be part of the Attento Ketamine Assisted Psychotherapy team. I would like to introduce you to Ketamine Assisted Psychotherapy, otherwise known as CAP for short. In this process, the medication ketamine, which is technically classified as a dissociative anesthetic, can be used to change your level of awareness and create what I call an expanded state of consciousness. And in this very special expanded state, a psychotherapist who has been specially trained to work and guide you in this experience can help you in healing any wounded parts of your psyche. This can help treat conditions that have been refractory to many other traditional methods of psychiatry and psychology. As a doctor, my primary commitment is safety. I will carefully screen for any medical, psychological, or other conditions that we may have to account for in order to deliver a safe and effective CAP experience. This commitment to safety will also proceed during the actual CAP therapy session, in which I may need to make any necessary changes in the ketamine dosing or route of administration, or using any other medication that may be necessary to manage any side effects that may come up. Once again, all of this is in order to deliver a safe and effective CAP experience. As a referring clinician, you are a critically important part of this process, and we will strive to involve you in every step of the way. We want to emphasize that the CAP experience will be considered an adjunct treatment. It will be in addition to the treatment that you are already providing your client.
We understand that this is a process for your clients, and we would like to make it as streamlined and simple as possible. In our next segment, we're going to talk to you about how to get your clients referred to our clinics. They may be evaluated and undergo the next steps to enter our CAP program.
We have set up an entire team whose job is to be more or less the concierge for your referrals to Attento. This intake specialist will guide the process and your patient through the initial startup, finding out information. They will also do a relatively initial screening just to make sure that it's appropriate and that nothing outstanding is there, so nobody has a waste of time. All that goes well, then that will transition to a best fit with a CAP clinician, who will then take the second level of intake and get prepared for the doctor's referral. V, you want to walk us through that?
Sure, so here you'll see an illustration of our service model. Our intake specialist first will meet with your client to make sure that they have a good understanding of the services, the costs, and answer any questions and provide additional resources should they need it. They will assign them to a best fit clinician that will do an intake with them, a preliminary assessment, and your client will leave with a deeper understanding of the CAP process. They will then put a referral into our prescribing doctor, who will meet with them for a medical assessment to make sure that this intervention is a good fit for them and the stage in their life. They will put a prescription into our compounding pharmacy, and once the prescription is filled, our intake specialist will contact your client to schedule their block of 4 CAP sessions.
During the first session, as we talked earlier, we will do the preparation session, set and setting, there's the administration piece, and then there's the integration piece. As you can see on the screen, our first package is 4 sessions. It gives us the greatest opportunity over that short period of time to really diagnose dosage appropriately and also get a sense of what the impact and if there's any increase in dosage is needed across the 4 sessions. We're in constant communication with our medical team, as well as we want to be in communication with you so that this is your patient who will be returning to you. We want to make sure again that this is a team approach with you as a part of our team. Outside, yes, but also involved in collaborating. Somewhere around the third session, we'll begin to work with the patient around how's this going, what kind of goals, are we looking at extending the treatment beyond the 4? Does that seem appropriate? If so, we will be making that recommendation to return for a follow-up visit with our psychiatric team or our Dr. Todd, who is the anesthesiologist, to look at continuing the medication if we want to make any changes at that point in time, and determine what the additional number of sessions would be appropriate to the diagnosis and progress.
The pricing for all of this, we have it in bundle prices since we are doing the sessions in blocks of 4. It will be $2,000, and then that's for the intake with the clinician, as well as the 4 CAP sessions. There's an additional cost for the medical appointment with our prescribing doctor, and the medication is roughly about $50. So in total, it'll be $2,400. And I always look at it as an investment in themselves, in their mental health. And here at Attento Ketamine, we're able to work with any clients that need any financial assistance.
That's really awesome, and that's an important point. Again, as we said right at the outset, this is an individualized program. Our goal is to be able to make available to virtually everyone who's experienced treatment-resistant depression, anxiety, PTSD, etc., to create the environment in which this remarkable resource of healing is available to them and make sure that it's affordable. So please do not let anything make you hesitate to refer folks. We'll work with you and work with them on an individual basis. Also, after viewing this today, you have additional questions, we would be happy. Contact us. We'd be happy to come to you and answer any questions that you might have or further explain what is going on so that you feel really equipped to make the really good referral decision. Thanks so much for thinking about partnering with us, and thank you for what you do.